I am Dr. Vandana Pathak, a graduate in Ayurvedic medicine from State Ayurvedic College, Jhansi. I have done my specialization in Panchkarma from Podar Medical College, Bombay. Here I am going to discuss about Sjogrens Syndrome, about a case. This study was done on a female who was 40 plus and who had complaints of enlarged salivary glands, dryness of mouth, gritty eyes, swollen eyes, recurrent skin infection, severe muscular fatigue, joint pain, and was almost immobile. The diagnosis was done by MRI and certain ophthalmic test and blood test in Department of Immunology SGPGI with confirmation with biopsy of salivary glands from buccal mucosa. Let us first know about Sjogrens Syndrome. Sjogrens Syndrome is a disease in which patient complains of dryness of mouth, xerostomia, dry, gritty, red, painful eyes, that is keratoconjunctivitis, dry vagina, severe muscular fatigue and pain, feeling of high-grade fever every time, multiple joint pain with stiffness, dry skin causing severe skin infections, that is cellulitis, etc. On examination of the patient, the buccal mucosa was found to be dry, the color of the tongue was red, the gums were inflamed, there were enlarged salivary and lacrimal glands which hypertrophied due to compensatory mechanism because of less production of saliva. In brief, it is an autoimmune process affecting the exocrine glands, especially lacrimal, salivary and sweat glands. It may occur alone or in context of another autoimmune disease such as rheumatoid arthritis, etc. The disease may affect the nervous system, lungs, kidneys, in addition to exocrine glands. Fatigue, joint pain and neuropathic pain are significant source of disability. Later complications may include even blindness, dental destruction and oral candidiasis. The treatment in modern medicine is restricted to symptomatic treatment with installation of artificial eye drops, blockage of the ducts of the gland to preserve the tears. Some analgesics, hydrochloroquine tablet for reduction of joint and muscular stiffness is prescribed by several practitioners of modern medicine. Myself, being an Ayurvedic graduate, thought of finding a remedy through Ayurveda. But I am extremely thankful to the whole team of doctors of modern medicine who helped me in this venture. The doctors of Kanpur and Sanjay Gandhi Postgraduate Institution from Department of Immunology. The whole plan of treatment through holistic approach was Ayurvedic Panchkarma, which included Purv Karma, Pradhan Karma and Paschat Karma. Yoga included the traditional Patanjali Yoga and the modified B.K. Iyengar Yoga. Meditation, which was followed by balancing of the chakras, and this was taught by Dr. B.K. Chandrasekhar from Sikfa Solutions. Ayurvedic Panchkarma was decided as all three doshas seemed to be unbalanced and Shaman Chikitsa, use of medicines only to cure the disease, was not sufficient without cleansing the whole body channels to open up channels that is strotas. Ayurvedic graduates know about it well, but a brief description of Panchakarma is here. Panchakarma means 5 therapeutic techniques of the unique speciality of Ayurveda after preparing the body with Purv Karma to facilitate total cleansing. Purv Karma includes Deepan Pachan, that is intake of herbs which aggravate the digestive fires to digest the ghrith, ghee, administered for internal oleation and external oleation. These vitiate the toxins from their place of storage towards the stomach to finally expel out through Pradhan Karma, Vaman, Virechan, Basti, Nasya, Rakta Mokshan. Vaman is the expulsion of vitiated doshas through mouth. It is induced by administering certain Ayurvedic herbs through oral route. Virechan is expulsion of vitiated doshas through rectum. Here the drug is administered through mouth and the vitiated doshas are expelled through rectum. Basti Karma is administration of medicated oils and decoctions into rectum with the help of enema pot or other methods to pacify aggravated Vata. Nasya is administration of medicated oils powders, etc. through nostrils. Rakta mokshan is taking out of impure blood from body by bloodletting with syringes or other ways. In this case, although Nasya and Rakta mokshans were not done. The meal in this case given a night before inducing Vaman was khichdi with ghee. In this procedure have been already discussed, but the powder used for induction of Vaman in this case was Madalfal Bachcha powder with little honey, and the powder used was in an amount of 3 to 5 grams, and this was administered after giving milk with full stati to the patient, who was advised to come empty stomach in the morning after passing stools. Here the ghee which we selected was Panchatikta Krit Kukul, and the oil for external massage selected was Mahanarayan. The selection of this Krit was done as the herbs in this contents have a positive effect on skin, which becomes dry and itchy in this disease. The oil Mahanarayan was selected to control the symptoms of joint pain and myalgia. The liquids used for increasing the volume of incested amount for total cleansing was milk and licorice fant. Vaman was followed by strict monodiet schedule of Mard, Peya, Vilepi, and it was only after 15 days of Parihar Kal that Virechan was done. Virechan in this case was induced with Abhyadi Modak 2 tablets with lukewarm water, followed by warm water whole day long. The diet regime followed was again the same as after Vaman, after which Parihar Kal of strict diet schedule was planned. Yog Basti in this case was planned with the oils Til and Mahanarayan, and decoction used was Dashmul and Rasna with addition of Sandhav salt. First 2 Bastis were with oil, known as the Anuvasan Basti. The third one was decoction, and this was now alternately done till the last Basti was oil Basti. Anuvasan Basti was given after light meal, and Niru Basti was given on an empty stomach. As earlier discussed, Shodhan, that is cleansing through Ayurvedic Panchkaram techniques, play a major role in reducing the symptoms of Sjogrens syndrome. But with this treatment, traditional Patanjali Yog Mudras and the modified Sri B.K. Iyengar Yog Mudras played a big role in reducing the symptoms too. Here are the ones which were followed by me. It was concluded that after full 2 rounds of Panchkaram with strict yoga and meditation, the patient came to comfortable life without using artificial tears anymore, and absolutely no medication was needed, neither Ayurvedic nor allopathic. The patient could walk comfortably at a stretch of 6 kilometers daily morning and evening with an hour of yoga and meditation. Comfortable climbing of stairs was possible in speed. The buccal mucosa was now found moist with marked reduction in the size of salivary and the lacrimal glands, with good activity of these glands producing ample saliva and tears. The skin of palms and soles was better. The immune system was boosted up as the patient was not now susceptible to any infection. The pathological examination could reveal better results which are due at Sanjay Gandhi Postgraduate Institution with reduction of weight of the patient by 14 kg for good. As an Ayurvedic practitioner, I would recommend certain do's and don'ts. The patient with Sjogrens Syndrome should follow strict diet avoiding yeast, pickles, stale and heavy fast foods, should cleanse the body channel at least once a year, should practice yoga and meditation and enjoy happy and healthy life without any medication. In the end, I would like to reveal that the case study I did was on myself, and there is a whole list of people who helped me in this case study and therapy. Dr. B.R. Tripathi, MS, he is a surgeon of Ayurveda. Dr. B.D. Shukla, MD, he is a Panchakarma specialist at Jamnagar. Dr. Mrs. Anjana Sharma, who is diploma in Panchakarma from Jodhpur University and belongs to Kota. Dr. Nityanand Pandit, who is an MD Ayurvedic medicine from Kota. Dr. Sumant, MD Panchakaram, Podar Ayurvedic Medical College, Bombay. Dr. D.N. Sharma, who is a naturopathist, for his constant blessings. Dr. B.K. Chandrasekhar, who is expert of meditation, for his blessings and guidance and runs Sikfa Solutions. Yogacharya Shri Om Prakash Saini, who is expert in traditional Patanjali Yoga and Shri B.K. Iyengar Yoga. My friends and my whole family, especially Dr. Anju Mishra, who is BMS and practicing in Kanpur. Dr. Vinita Avasti, who is a gynecologist and practicing at Kanpur. Dr. Savita Sahu, who is DGO in gynecology and obstetrics and practicing at Kanpur. And in the end, my husband, Dr. Vinay Kumar Pathak, for his constant support and moral boosting during this study. Thank you.